Now back to the reality of a nurse's day. It's midday for Katherine, around 2 p.m., and time to catch up with her. Because of patient privacy and the more complex work Katherine needs to do, we can't follow her everywhere. But she is gracious in allowing us to accompany her for some of her work.
Well, being quite busy a little bit, okay, and giving out the medications, getting orders from the doctors, and then calling them also, running between, and also running down to pharmacy to collect medications, and also helping out do our care with our patients. So we've been kind of hectic this afternoon. Yeah, sometimes it's even more busy than this. Yeah, have a lot of people, like the nurses, the doctors, the physical therapy, everybody, and then you have a lot of work you have to do with your patients. You have to go in with your patient. Unfortunately, you don't have enough time, but we can all sit, like if you have a patient, you go and sit with them, talk with them, do some teaching work with the patients. You really don't have that much time for that. So the little time you have, you go in, do your medications, most of the time. While you're there, you still talk a little bit with them, ask them a few questions, anything, and then you're out on to the next one.
If you could wish for one thing to make things easier, what would it be?
More staffing. And of course, more staffing, I think the more staffing we have, the more we'll have more time for each patient. You'll be able to divide your time and at least stay some time with the patient, you hear our words. Sometimes they need somebody they can talk with, and from talking with them, you can learn more what's going on.
Now that we've explored the far-reaching crisis we call the nursing shortage and have a glimpse of its impact, the interview team needed to explore the causes of the shortage itself. Why don't we have nurses? It seemed the comments on the cause of the nursing shortage naturally ended up in about 4 major categories: image, choices, education, the job itself. Let's hear what people had to say about the causes of America's nursing shortage. Educational factors and access to education as a causative factor.
What happened was the community colleges and the State University and University of California system, they were being told by the industry, oh, we're not going to have a need for nurses, in the early 90s. Given that, they said, well, we can cut these programs, and they did. And so now they say that that was a failed projection, that of course we do need more nurses. That was a real bad error on the part of the healthcare industry.
The faculty are aging. The average age is around 50, middle 50. In about 10 years, these are going to retire.
UCLA used to have a bachelor's in nursing program. They are now positioned to start a program again, except they don't have the funding.
No, unfortunately, you can't come to the University of California entering right from high school to get your nursing degree. We had that program up until 1995, when the budget cuts of the early 90s in the state of California eliminated the undergraduate nursing budget. If you're saying that the top 12.5% of high school seniors in California should be allowed to come to the UC system, if they want to be a nurse, they can't.
The shortage is so great that if we all continue to graduate the same number, we still will not meet that shortage.
When we look around California, for example, and see waiting lists of 6 to 18 months to get into a nursing program, and watch nursing programs close, which is causing that waiting list to grow, we've got to stop that. We've got to reverse that trend.
1,059 students at the freshman level are on this university wanting to be nurses. You know how many we can accept? 36.
Our legislature here in the state of California has really failed to provide funding adequate in all of our public systems. The University of California, the Cal State system, and in our community colleges. We simply have not had an adequate pipeline designed to prepare this state's nurses, nursing workforce, or our national workforce. It's an important point, I think, to make that about 50% of California's nurses weren't educated here, meaning we either imported them from another country or we kind of borrowed them from other states. So we've been working in a deficit in our educational pipeline for a long time, and the results of that are now can be seen at the bedsides in our hospitals today.
On the career choice as a cause for the shortage.
There are so many more options for women than there were, when we were in the 60s. It was school teaching, social worker, nursing, if you wanted the college route.
I think at the time when I finished high school, there really weren't very many opportunities. My older sister was a nurse. My next sister was a teacher. And at that point I thought, oh, I don't want to be a teacher, and so I guess I'll be a nurse.
Nurses, women nurses, prior to the feminization of the world, if you will, were welcome, and that was actually a profession for women.
Women's movement was a factor in leading the women, instead of to nursing, into other higher paying, higher status position.
And of course now you can be anything from a rocket scientist to whatever.
And I think that one of the reasons why the shortage is as severe as it is today is that now a lot of women have a lot of different opportunities. I say women because the registered nurse profession is still about 95% female.
You have a terrible problem of the average age of a nurse being over 40. And what do most 40-year-old women want to do? A lot of it's not working a night shift in an acute care hospital. Right. So there's more options even for nurses to do things that are more standard with society's Monday through Friday day shift work week.
The job itself as a cause of the nursing shortage.
If you overload the system, or if you set it up so that it can't possibly work, you're not going to get good care. And blaming it on somebody and doing all those kinds of things isn't going to make any difference.
And when you work day in and day out, all you need is a simple thanks sometimes, not the blame. You know, you want to be proud that nobody died on your shift, that you saved somebody, you transferred somebody to ICU before they die on you, or even if they're old and dying, that, you know, sometimes you're there at the bedside. And it's satisfaction enough.
And you look at the responsibility the nurse has. It's a life and death decision they make.